It's nice to see so many people joining. Welcome, everybody. Yeah. We're going to give you another minute or so that we can give people who are just coming from the other session time to come into this one. Maybe in the meantime, people can write in add to the chat where they're from so we can get an idea of our geographic spread.
Wonderful. So we'll start. So hello, everybody. Huge welcome to this session. Thank you so much for coming. We're really excited to be able to talk with you about the International Union for Health Promotion and Education position statement on health literacy, and just to have a think about how we can use this valuable living document to improve our service and our research, and therefore benefit the people that we serve. So we're just going to do a quick introduction to the team and just show you what we're going to talk about in this session. So as I've said, I'm Jill Rowlands, and my colleague Diane Levine-Zamir is going to take over from me in a moment and talk to us about the position statement, which she's been so instrumental on leading on. So here we all are, it's really nice to see such a global representation. So you will hear from all of us as we go through this session. We want to do this in memory of two very dear and very missed colleagues. A lot of you will have met either or both of these guys who've just been such leaders in the field, and we continue to miss them, and this session is in honor of both of them. So what we want to do is we want to introduce to you the revised position statement on health literacy, to share some reflections from international partners on the role of the position statement as an advocacy tool, and to talk with you about how we can use this document to take forward our research and practice. So Diane's going to go first to talk about the position statement, then Christine Sorensen's going to reflect on policies at global, regional, national and local levels. Susie Sykes is going to talk about traditional and non-traditional settings. Okan's going to talk about advocating for health literacy through the life course. Louise Saboga Nunes is going to talk about how we should be building health literacy capacity within the workforce. And then Tatine Sentel is going to lead us in the discussion. So as we go along, if you have questions, and we really hope you have, put them into the chat and we'll come back to them and answer as many and discuss as many of them as we can at the end. In the chat is a link to the position paper, so you can go and start looking at the paper now, or of course download it later. And rather than continuously repeat the definition of health literacy as we go through this presentation, this is the definition that we're working to. So I won't read it in full. It's the latest definition adopted by WHO and developed by Nutbeam and Muscat. And it looks at the competencies, how they accumulate in everyday life, how it develops across generations, and how the knowledge and competencies of individuals operate very much within the setting within which people are living. So at this point, then I'm going to hand over to my colleague, Diane. Thank you, Diane.
Thank you so much, Jill, and welcome everybody. As we speak, if you can even mention in the chat where you're from or your name so we can kind of get to know you as the session continues. We're going to talk right now about just setting the scene about what the position statement is all about, why we developed it, and what we hope what are the different aspects and the action areas, and why do we have a new version of it. So we'll take you a little bit through the history, and I, again, thank my colleagues here on the session who've been working so hard to not only for the session, but to develop and redevelop and revise the position statement. So let's go to the next slide, please. Okay, so what actually is the position statement, and what did we set out to do? We actually realized it was around 2015, 16, 17. We realized we had so much amazing research taking place on health literacy. We realized there's so much practice in health literacy, and there were policies in place. And in a minute, Christine will give us a few examples of that. But we realized we didn't have a statement, or we didn't have a document that would help us advocate for health literacy, particularly within the International Union of Health Education and Promotion, which was promoting health literacy at the time, in addition to what was going on clinically in the States and also in other parts of the world, looking at it in a social aspect. So we realized we wanted to have a document that we could work with other institutions about health literacy, that we could share what we think should be happening in health literacy, and help bring people together for a discussion. So we developed it, and it was the first edition was ratified in 2018 by the Executive Board of the International Union of Health Education and Promotion. But we developed it through a very participatory and ongoing consultation among global stakeholders. And there were many, and there are even more now. A lot of discussion about what needs to be in a position statement. What are we advocating for? What are the action areas that we're calling for? And the first version was published in December 20. It was released in November 2018, and it was published the next month. And it was pretty fine and pretty helpful for about a year or two. And then what happened was that we learned so much more about what needed to be done once we were all dealing with COVID-19 and realizing how central health literacy is for public health and clinical practice, even more so. So we thought that we needed to revise the statement. So in the next slide, can we move to the next slide, please? Thanks. What we had done up until then was that we had published it in a journal. It was on the IUHP webpage. We used it for discussions in the WHO and in other conferences, regional, national, and international. We used it for teaching, for capacity building, because you'll see it's a very rich document, and also for advocating, which is really what we set out to do. But we knew it was going to be a living document, and we knew it would be necessary to update, but we had no idea how much so until we really hit 2020 and realized what was going on in the world. So can we go to the next slide, please? Thank you. So we set out in 2020 to begin discussions about the update. The second version, we started in 2021 having discussions, examining and analyzing the action areas that were and are in the document. And we realized that health literacy was such a major role in managing the pandemic, and the importance of including health literacy in crisis, emergency, and disaster plans. So we set out to revisit everything we had done up until then and have more discussions about where the position statement has to reflect what we had learned. So on the next slide, thanks. Go forward. Can we go forward? That went back one. Let's go forward again and again and again. Same direction. Thanks. So I'm going to walk you really quickly, walk you through the action areas. So the action areas mainly stayed the same action areas as we had before, but the content is richer and reflects more about what was going for 2021 2022 and forward. Why does it take so long? Oh, we can go back one, please. It did take a couple of years to have the discussions going, because as the pandemic moved on, we realized how infodemics were such an important part. So we revised that part, and we realized what research was coming out about health literacy and COVID. And so we had to also update, and plus look at other aspects that we felt were a bit older and needed to reflect the more updated research and the more updated literature. So the first action area is promoting systems approach to health literacy and policy. The action area is health literacy and policy. So you'll hear more about this aspect when Christine presents. Can you have the next slide, please? We also want to make sure that we include health literacy in global, international, national, and regional policies and strategies for health promotion and social determinants, meaning that we're in discussions with our global partners, international partners, national and regional policies. We wanted to make sure that we were promoting and advocating for health literacy to be part of these policies. But maybe we could call it health literacy in all policies. So you have another section about that, and you'll see more about this with our colleagues present. The next section, the next action area. We can go to the next slide, please. Thank you. We will recognize that health literacy is content and context specific across the lifespan. So much research has been done in the past few years to looking at health literacy in different age groups, looking at digital aspects, how they affect the younger people, older people. So we were even more ready to include this aspect in the revised version and look at how much was being done from 2020 onward with kids, with older people, and you'll see this in a minute when Orkan presents. Next action area, please. And when we looked at what was going on in the community and community-based process for empowerment, we saw that much more was being done and also what the needs were. You'll see more when Susie presents, but we even saw how much cultural aspects of health literacy were even more in the past few years, and how important citizenship and including people from the community in a participatory way in building the health literacy development and organizational health literacy. We saw how much that was even more so than in the past. So you'll hear a little bit more about that, but we have a whole section about this in the position statement. The next slide, please. We also call for more funding and more research. Of course, it won't surprise any of you, but we realized how much we knew and how much we didn't know. And for example, the issue of emergency plans that include health literacy, what is being done, what is effective, what practice was bringing more results. We realized how much that research is lacking, and also how much funding is lacking for that. And I say that in light of what we saw was happening during the pandemic, where so much resources were all of a sudden allocated to public health, and resources that we didn't know were there in the past, or we didn't think would be there, they were. But where was health literacy in funding the practice and funding the research? So we really call for that in a very specific way in the position statement. And the next slide, we just have a couple more. We want to identify stakeholders and work in collaboration. It's so critical to be able to work not only on a systems base, but also work interculturally, interdisciplinary, interorganizationally, and make sure that we're working together in collaboration. We really want to mainstream health literacy even more than we've done in the past. So this includes building capacity and sharing knowledge, training, and you'll hear a bit more from that from Luis when he presents. And the next slide, please. So in conclusion, the position statement really highlights the role of health literacy as a cross-cutting issue for the advancement of global health, even more so than when we first presented this at HARC in 2018. So thanks so much. I'm going to now hand over to Christine, who is going to talk about global advocacy for health literacy, which is our first and second action area in the position statement. So thank you.
Yeah, thank you very much, Diane. And I'm calling in from the end of the rainbow. So this is the art museum in Aarhus in Denmark, where I live now. And if you ever come here, I invite you to have a stroll in the rainbow. Next slide, please. Thank you. So I'm talking about the advocacy role for health literacy, and we do see an increasing awareness about health literacy and its relevance for policies. The positive story is that health literacy is now recognized as a modifiable determinant of health. And based on analysis, we know that it contributes to the Sustainable Development Agenda of the United Nations, directly, of course, in the area of health, but also indirectly to the other 16 areas. So this is a positive thing. However, as I will show in the next slide, Jill, is that we still talk about a gap. And we call to action in terms of bridging this gap, because we know from our research that some countries are still not having the levels that we really strive for. And we see this in the next slide, you know, where we see this is an example from the European Health Literacy Survey, but across the world now, organizations, research units, and so on are delivering the evidence that we can do better with health literacy, and we need to target our efforts to specific groups in need. But really, when we talk about policy, we see that very often it's evidence driven, and that more and more countries are now delivering or developing their baseline studies for health literacy. Next slide, please. So talking about then the policy arguments that we use for doing advocacy to promote health literacy in the policy space is very much the arguments that it saves costs, it saves time, and it saves lives. Next slide, please. We also want to focus on how to design interventions at local levels, so having the strategies and policies at national level, regional level, international levels, but also at local levels, and much of the action happens at the local level, and this is where we want to design interventions in a targeted way, and the evidence is guiding us because no one size fits all. Next slide, please. And it's not only about the health literacy of the public, but also very much on how we design our healthcare systems. And one main message that we keep posing to decision makers is about decreasing complexity in systems, introducing plain language, and tearing down barriers. We saw this with COVID-19, we see it with digital health, vaccine literacy, cancer literacy, and so forth. This keeps being a main policy message for us to decrease complexity. Next slide, please. A main issue is also how to build equity across the health ecosystem. And we want, again, to move away from one size fits all, where everybody gets a bike, but if it doesn't fit, it doesn't help. And we want everyone to be creative, to overcome issues, and talking about distributing resources in an equitable way. Next slide, please. And in our position statement, we highlight that we need to adopt not only an organizational approach to health literacy, but really also a system approach. And this paper was published with some of us as authors in collaboration with the World Health Organization. And you see here that, yes, health literate organization is one area of work, but we also need the management buy-in, people-centered approaches, leadership, and financial resources, and partnerships, because this is happening within the healthcare sector, but also beyond the healthcare sector. Thank you, Jill. Next slides, please. I will now show you some resources that has been developed across the world. In Europe, we have a resolution developed by the World Health Organization that actually gives mandate to member states to take action on health literacy. And some of us all know the Solid Facts leaflet for many years. I think it has its also an anniversary of 10 years now. We have a new resource developed by Professor Osborne from Australia in collaboration with the NCD department in the headquarters of WHO. And some of us, Titin and I, we were involved with the European region to develop a brief impact report on local interventions in primary care. Next slide, please. And these are freely available. The same with this one. This is a guide to health literacy, contributing to equitable access to healthcare. It's developed with Lena Packari and the team at the Council of Europe in Strasbourg, and they have adopted a human rights approach. So they consider health literacy and access to health a human rights, and are keen to involve professionals in this work. Next slide, please. There are a few more with resources that you can adopt and which has also been guiding policy. This is from the UK, and Scotland has already adopted 2 national action plans. The first one was called Making It Easy, and the next one, Making It Easy. And we are now curious to hear about the third one. But as part of this, there is also a platform with lots of health literacy resources called the Health Literacy Place, and I encourage everyone to go and visit. Next slide, please. So a few other examples include the new guide from the Danish health authorities called Health Literacy in Danish Healthcare Organizations. It focuses on organizational health literacy. It's an adopted guide based on the 10 attributes of health literate organizations developed in the US by Brach and her colleagues, but we needed to tailor it more specifically to the Danish healthcare system. And you see an example that is some years old from Australia. It's called Taking Action to Improve Safety and Quality. So this is another key message when we talk about the policies, that it also clearly relates to safety and quality of services. Australia is now in the process of developing a new national action plan, but this was a profound document where you can find lots of ideas. Next slide, please. So I'm talking about also going beyond the healthcare sector, and an advice that keeps coming up when you talk to decision makers is we should start early. So with Orkan Okan, who's also here in the call, we've developed a policy brief on health literacy in schools, and there are several policy briefs in this area. This is just an example. And with 100 researchers, we've written the International Handbook of Health Literacy. Many of you are probably involved in this, and it's again also a background resource that you can offer to decision makers as part of our advocacy. The next few slides I want to share is the challenges that we still work on. One is on digital health literacy, again to start from an early age. And it was highlighted also by the World Health Organization recently in their digital symposium. So we need to think about how we can decrease complexity as part of digital health, and again, start from an early age. And in the next slide, I mention also the area of mental health literacy, which is getting increasing attention, again, starting with schools and young people, but also health and work, where we know we can use health literacy as a lever to increase health and well-being, and at the workplace where people in the healthcare system is working under tremendous pressure. So just a reminder for ourselves. And at the end of my presentation, I would like to highlight how many different interest groups are now being shared. So this is our presentation from the International Union of Health Promotion and Education, from our global working group. There are also other national and regional communities that you can join. And in my next slide, I present what events you can join. So HARC is, of course, a very established event that we all love to join, but we also do invite you to be curious and join events in other parts of the world. The next Asian Health Literacy conference will be in Vietnam in May next year. and we will host our second Global Health Literacy Summit of the International Health Literacy Association next year in the Netherlands, and more information will follow. And our African colleagues hosted their first virtual regional health literacy health literacy regional conference, online in August. So this was, of course, a big step. And I just came back today from a visit to Middle East. So Diane is working very much to promote the health literacy across the Middle East, and other countries are now starting to follow, which is really great. But we don't have really large regional networks there. The same for Latin America. There are very active colleagues in Brazil and in other countries, but we are looking to strengthen the bridges. So this is for all of us to bridge around the world and learn from each other and inform and qualify policies. So the next slide is just to show you how you can join the IUHPE, and you can join the International Health Literacy Association as part of the global community. And in my last slide, I have
this is one more minute. Thank you.
This is the last slide, all the resources that I have mentioned, and feel free to download and use it, and also get in touch with me and the team here if you have any questions also after the session. Thank you. Over to you, Diane. Thank you for the attention.
Thanks. Just before Susie begins, I'm going to try to again post the link, but I have a feeling, I don't know if any others can see it. It seems to only the hosts and panelists are seeing it. Maybe Jesse, somehow you can copy what I just posted and put it in the chat so that all of our participants can see that link as well. And but I think we are seeing their chats. So I'm not sure if they can see our responses. So maybe we can just help share that in some way. Okay, great. Thank you so much. Good. So we'll also be having a look at what you're saying in the chat. And again, we invite you to say to write and to just add to the chat where you're from, so we get an idea of who's here with us now that the chat is open. And thanks so much, Jesse, for opening. So over to you, Susie. Thank you so much for joining us and being such a very active part in the leadership of our global working group in health literacy, and for presenting now the traditional and non-traditional settings for health literacy, which is an important part of the position statement. Over to you, Susie.
Thanks, Diane. Yes, it's been wonderful to work on the second edition of the position statement, and with such engaged colleagues working so internationally. So I'm going to talk briefly now about two of the different action areas included within the position statement, and dig down a little bit into those two action areas under the heading of supporting traditional and non-traditional settings for health literacy. And in doing so, I hope to give just a little bit of a rationale as to why these action areas are important, and then drawing on some research undertaken by myself with some colleagues of ours at London South Bank University in London. I'm going to try and demonstrate or give some examples of what we might need to think about in implementing them. But before I turn to those action areas, next slide please, Jill, I'd just like to refer back to the definition of health literacy that we've included within the position statement, and you'll all be familiar with this or similar definitions, so I don't want to read it to you again. But what I did want to do is just reflect on the fact that certain elements of this definition do receive or have received more attention in health literacy research, policy and practice than others. So much of the focus has been on the individual competencies and the interaction of individuals with information sources, the measurement of individual outcomes that come from health literacy competencies. More recently, we've seen a much greater emphasis on the interaction with and responsibility of organisations in mediating health literacy, and this is really to be welcomed. And there is still much work to do on this area. But what has received a little bit less attention, I think, within this definition are these other points that I've put in bold. So there's been far less attention on health literacy as something that accumulates through social interactions, and the importance that networks and communities play in supporting health literacy. And secondly, I would argue that there's been less emphasis on the impact of health literacy beyond the individual, so on those people around an individual and on their wider communities. And the importance of these elements within the definition of health literacy are that it shifts us away from an individual and helps us to understand how health literacy can be seen at population and community level, and the potential impact that that might have on inequalities in health, which are such a priority for us. And so the position paper, I think, has sought through the action areas that it focuses on to ensure that these more social definitional elements are captured and that we move away from a narrower individual and functional understanding of health literacy. And I think that that's a really important contribution of the position statement. So I'm going to talk briefly, as I said, about two of the action areas that I see are important in ensuring this shift. Next slide, please, Jill. So the first action area I'm going to talk about is that of emphasising that health literacy interventions should be people and community-based process for empowerment. So within this action area, there's an understanding that health literacy is an asset for people, and that the process of developing health literacy needs to be people and community-centred as a process of empowerment and a recognition of, importantly, of health literacy as a form of citizenship. And that the empowerment-based citizenship is fundamental for our understanding of health literacy. And the outcomes of this are important, not only so that individuals can make healthy choices, but also so that their understanding of health and all of its determinants enables individuals and communities to form part of that political and social action that we need in order to ensure healthy communities and healthy environments. So this action area is based on an understanding that building health literacy will enable individual change and that that is important, but when seen as a community asset, will importantly help to strengthen that collective action for health. Thanks, Jill. So colleagues and I have looked at the importance of social interactions as part of health literacy through a number of different research projects that we've looked at. And I've got reference to here now, one undertaken around the issue of infertility and another study that we undertook during the pandemic. And it's important to recognise that in today's world, the communities that I'm talking about don't just exist in a physical world, but also increasingly exist as virtual communities in online spaces. And both of these research papers showed the centrality of those online communities and demonstrated how they acted as a pivot point for making sense of and rehearsing information prior to action. So understanding what happens in these spaces, in these social spaces, is so important. So in these studies, we saw participants returned to online communities again and again as they sought to fill the gaps in their own knowledge and understanding, but also as they drew on the skills, experience and knowledge of others that they trusted within those social spaces. And in the case of infertility, where participants told us there was particular stigma and particular emotional challenges, participants continually moved between three spaces, between the digital platforms where they accessed information, the online communities where they interacted with others, and that with healthcare professionals in clinical settings. And they used these three spaces to gain the health information that they needed, but that it was the online communities that were central to the process and to which they continually returned in their information-seeking process. And it's this space that was used to access information, to discuss and seek understanding of information, to test the credibility of information, and to rehearse decision-making and communications that they then took to healthcare professionals. And within this space, individuals became not only consumers of knowledge, but purveyors of knowledge. And that was an important transition. So understanding these social processes, really important for public health. Obviously, it creates a danger for the spread of misinformation, and we've seen that, but it also provides us with the potential to use these mechanisms, if we understand them, to target our public health messaging and information. And important in both of these studies was the sense of the collective alongside the sense of self. And I think this provides a really important opportunity to move towards collective action, which might have a more sustained impact on determinants of health. Thanks, Jill. The second area action area that I'll talk briefly about which I also think is important in ensuring we move beyond an individual and functional focus on health literacy, is the action area entitled Promoting a Systems Approach to Health Literacy. And within this, the position paper talks about the need to promote health literacy at a number of different levels, including locally, nationally, internationally, and globally, as Christine has so helpfully illustrated. And that to do so, we need to have a unified and comparable approach that can be applied across different contexts. So this action area emphasises the need for both programmes and policies to be developed and delivered within the different settings within which people operate, and which are important for the development of health literacy. So that includes health organisations, but also other organisations that people interact with, such as their educational settings, workplace communities, and so on. Thanks, Jill. And again, just to give an example of the relevance of the different types of settings that are important for consideration within work to develop health literacy and the multiple tiers that exist within a setting and within a system, I just briefly refer to work that's been led by my colleague, Dr. Catherine Jenkins, that's looked recently at libraries as a setting for the development, specifically of critical health literacy, but this translates to other domains of health literacy. And it's just a really interesting case study, because through this work, an institutional ethnographic study was undertaken, through which a settings-based approach was used to analyse the potential of public libraries in England to be supportive environments for children's development of critical health literacy. And the findings of the study showed that while the libraries and the library users did not necessarily see themselves or see the library as a setting for health, the policies and structure of the libraries did provide opportunities for its development. So there's clearly opportunities there. And that there were also examples, sorry, 2 minutes.
2 more minutes?
Yeah, no, I nearly finished. And there were examples in these findings that arose where critical health literacy could be seen to be developed. And the model that I've just put here now, that's been developed from the study, just shows those multiple levels at which those opportunities existed at a micro, meso, macro levels of the organisation. But importantly, it also identified that the library alone was not enough to develop children's critical health literacy. It also required a supersetting approach that requires us to look beyond the organisation at those other organisations that operate around it and work in partnership with those in order to really maximise the potential. So I'll stop there, but hopefully that gives you a bit of a flavour of two of the action areas and how we might use the position paper to take those areas forward. And I'm going to hand over now to Orkun Okun, who's going to look at some of the other action areas within the position statement.
Wonderful.
Thank you so much, Susie.
So I'm going to stop sharing, and Orkun, I'm going to hand over to you.
Thanks a lot. Can you see my screen now?
Yes.
Yes.
Perfect. So I will be talking about the aspect of advocating health literacy throughout the life course, while I will rather focus on children, adolescents, and schools. And this perfectly matches with the last slides, the last things that we heard from Susie's side, how important it is to promote critical health literacy as early as in childhood. And when we do that, I believe it is very much important to acknowledge that health literacy is context and content specific. This is the model by Parker and Rodson that you all know, that was presented like in 2009, in 2010, which distinguishes health literacy into two interdependent dimensions. You have the behavioral level with the personal skills and knowledge and attitudes, and on the other side, they have to match with what's offered on the systemic, on the environmental level, the systemic demand, and the complexities. And while on the left-hand side, we have kind of a personal health literacy, so the individual competencies relevant when managing health information, what we call agency, in order to focus on the individual to get a behavior change. And the definition you see on top. On the right-hand side, we have the definition of organizational health literacy. And both these definitions, personal and organizational health literacy, 2 years ago have been included to the Healthy People 2030 by USDHHS. And the organizational health literacy concept, of course, aims at changing the environment, social change, and at the structures. And at the bottom, you can see the definition of organizational health literacy. And I believe these two definitions are very much important throughout the life course, and in particular, when it comes to children and adolescents. And I particularly like very much the term that Susie has just used. I was not aware of the term supersetting in Germany. When we talk about what Susie was just talking about, we call it regional or regional health literacy, meaning that we address entire organizations and chains of organizations within one settings that are relevant to promote health literacy of children. And on this slide, I think it will become obvious why it is so important to address health literacy in schools, in children and adolescents. A couple of years ago, we did an evidence synthesis for schools for health in Europe, and kind of this is the picture we came up with. You see the red square with health literacy. We found a lot of studies that indicated that health literacy has a direct impact on health behavior and health-related outcomes. And in the same studies, it was suggested that health behavior impacts the health outcome of children, of school children in particular, because these kind of studies were those that we have looked for in our review. And health outcomes impact educational outcomes. And I think this is very important when we want to address health literacy in schools, because schools have the mandate by the educational ministry to promote educational competencies, and they need to know what is the benefit of addressing health in their setting. And we can show them this and tell, look, if you address health, and in particular health literacy, this will have an indirect health on your educational goals. And we know that education itself is a determinant of health and relevant to health outcomes, to health behavior, and to health literacy. And starting this model, you can see that we have the structural, environmental, and contextual factors that kind of impact also personal health literacy of children, which need to take into account. And in particular, this is relevant in the digital age. And what also is relevant in the digital age is that we are currently are in kind of a multiple crisis situation. We have climate, pandemics, war and conflict, digitalization, populism, and they all are interconnected, influence each other, and most of these or all of them are kind of relevant to our health. There's lots of communication and information online on these topics children and adolescents can access. We have an infodemic, an overload of information available on these topics. And then we have them all embedded in the children's and adolescents' information ecosystems, right? In where they interact, where they talk about health, where they produce health information on their own. And I believe these things are so relevant to digital health literacy that we have to make sure that we address these things early on in the life course. But of course, there are also many adults having problems with digital health literacy. But speaking of children, last year we launched a study, Digital Health Literacy in Schools in Germany, where we did a representative survey in all 16 federal states and assessed digital health literacy of teachers and students. You see, we tried to reflect a bit the relational model. Students with their personal health literacy and teachers as part of schools' organizational health literacy. And very briefly, this is what we found out, that more than half of the school children had difficulties with their digital health literacy, and in particular when it came to protecting their privacy, data protection, security of online information shared, with their navigational skills when they were seeking for information and services online, and also with their critical health literacy. So these were kind of the greatest challenges that we identified. And it was very much similar with teachers. We didn't expect that because teachers have a high educational attainment, and we would have expected them to have a much higher digital health literacy. But in fact, also more than 40% of the teachers had low levels of digital health literacy, and very similar to the children problems with data protection, security, and critical health literacy. but instead of having problems with navigating, they had problems determining the relevance of online health information for their own everyday life. So this was kind of very difficult for the teachers. And to be honest, this is no surprise, because in that study, we also asked the students whether they would learn about digital health literacy in schools. And in the middle, you see the 7 dimensions of the Van der Vaart and Drossard model of digital health literacy. And you see across all these dimensions, almost 50% as a mean value said, no, we don't learn these things in schools. And it was even more severe, more serious with what the teachers said. And they said, yeah, we do not teach these things in the classroom. Yeah, you see that was even, these are even much higher numbers with the teachers than with the school children. And of course, then it's no surprise that so many school children in Germany and even teachers have problems with their digital health literacy. And then we look beyond Germany. In Germany, we don't have a mandatory health education. We don't have health literacy in the curriculum, though we have digital literacy or media literacy. And I feel these are very much related concepts. Diane Levin-Samir even has a publication on that, media health literacy, where you can see how interrelated these concepts are. But we don't have health literacy and health education. But other countries have curricula that address health literacy in Finland, Australia, the United States, and even last year in the United States, the 3rd edition of the health literacy curriculum was released, and in Portugal. For Europe, we have from Schools for Health in Europe, the European standards of a health promoting school, so the health promoting school of WHO. And you can see in the most recent version published in 2019, health literacy was defined as standard number 7 in these quality indicators for health promoting school. And maybe through that approach, we also will be able to address health literacy. Thank you so much. And now I'm stopping my presentation and giving over to the next speaker, Professor Luis Saboga-Núñez from University of Freiburg in Germany.
Thank you very much, Håkan. And thank you also for the opportunity to share some ideas that we have been working in this position paper. Please, Jill, you can move on. It is an interesting case to just emphasize what Håkan showed us about the situation in the educational sector in Germany. Please, Jill, can we move on? And it is interesting because we could ask, okay, so if we have missed it at school, where then can we address again the issue of health literacy? So what I would like to change a little bit with you now is about the workforce development and the capacity building in the workforce perspective, where we can have the emphasis on sharing knowledge, applying an intersectoral approach in order to develop the health literacy approach. Please, next slide. Also, thank you, Håkan, for introducing me to this one, because indeed, you just referred that the issue of resiliency, social resiliency, is at stake with several aspects. One of those is, of course, war and conflicts going on and everywhere, a little bit putting at stake the development of a social and fair society. Did you? And while the development of health, how can we, in times of crisis, in times of conflicts, look at the possibility of developing a sound approach to what a society means? That is indeed something that needs to be addressed at the workforce level. Please, Jill, next one. So a growing number of opportunities and frameworks for professional capacity building can be set, can be initialized, if you want, if we have not been able to do that in the previous years when people were at educational setting, could be developed in the workforce. The workforce development per se needs some very specific strategies, and these should include not only health literacy competencies, but also the training and education of both health and educational professionals. we could go through a whole bunch of research has been done at the level of health professionals, and we could check how the levels of health literacy is impacting on their daily basis activity. And the reason why it is so mandatory to do this is because if we aim at increasing the autonomy of citizens and giving them community control over the range of determinants of health, if we miss this, we are missing a global strategic approach to the well-being of individuals. And so, as it's being said at the National Health Systems in the United Kingdom, no decision about me without me. That means that even when we make the perspective of what is going on at the workforce, decision that is taken should be taken development of its own specific activity in the workplace. Next one, please, Jill. So for policymakers and for the concept of health literacy is sufficiently diverse to be used to support a full spectrum of policy positions. So improving health literacy can be presented to citizens and to the public at large as supporting a policy commitment to greater patient and public engagement in health decision-making. So for health promotion, and now when we look at the context where health literacy has emerged and public health practitioners in the government and non-governmental sectors, health literacy should be prioritized in continuing professional development. And why is there a need to do so? As we heard, if we look at the educational setting where we have professors, teachers missing the skills to improve, to increment health literacy at the student levels, when we consider other aspects of the social networks where health literacy can play a crucial role, we need to emphasize that this is not a one-day or one-time perspective of development. This is going to follow the individual to the life course. So continued professional development is indeed needed to do it. Then we have the holistic understanding of the social determinants of health and how the greater sophistication in the methods and content are necessary in the comprehensive integrated health promotion program in our societies, in our different settings. Please, the next one, Jill. Therefore, at the educational profile of universities, of institutions, and how whole institutions that are training teachers, how they have been included, or how they have included in their curriculum, in the vocational training, the health literacy topic. And this goes up to even to the school principals, because these are critical agents within the school when it comes to the school development, organizing the change and whatever health promotion is part of the school curriculum or strategy. We can see that there is a big pressure over here because in the curriculum developments, there is a huge demand for other topics that are considered mandatory in the preparation of those students to fulfill their roles in society. But how is health literacy positioned there? And then we have school teachers, of course, both the pre-service and in-service teachers that require health literacy training in order for them to build capacity to successfully promote the health literacy of the students at the school. So how can they do this if they themselves have not been empowered with the skills, with the tools, with the knowledge that is necessary to increment health literacy of the students? So the capacity building of all the stakeholders in the educational settings, not only those that we have already referred, but the school nurses, the school boards, and the lay partners, such as the parent advisory committees. How do these stakeholders are integrated in the process of building the capacity in the workforce towards the increment of health literacy. So we need more knowledge and experience in order to solve intersectional context and international emphasis, so that while developing networks and communities of practice among professionals and sectors at the national and international level, we may aim at the increment of health literacy. Thank you very much. So now we will continue with the discussion around these topics with Tétine Santel.
Lovely. Thank you so much. And thank you, everybody. Wonderful, wonderful presentations. And so, Tétine, let me introduce you to start to lead some discussions.
Sure. Thank you so much. Thank you all. Nice to have such a wonderful, engaged audience. And I would like to first give a round of applause to the panelists for their really wonderful presentations. Those were very informative, very useful, full of practical solutions and ideas, and really meant to inspire conversations around the living document that we have before us around how we can make change in our communities for well-being. So please join me in giving them a round of applause, and also for being so timely in their presentations, giving us the opportunity to really have a conversation with you all here. So we have the chat, which thank you to the IHA has enabled that. So we have the chat, we can talk with you all, and could see such a robust audience in attendance. And want to hear from you in the chat if you have any questions, comments, considerations, and we'll help guide that. And then also really wanted to begin us, I guess, with that conversation. And what I love about this document and the conversation, and how Diane so nicely set it up, is really that it is a living document that is growing and changing, and trying to add more practical considerations and resources, which, for instance, Christine shared so nicely, so many resources to really support and amplify this work. And it really is part of that. And as Susie so carefully shared with us, really the impact not only for individuals, but also across levels of population health and well-being and in communities for impact. And as Orkin shared so thoughtfully, really then how we do that within organizations, and with organizations over the lifespan, right? How do we think about children? Where do we build that? Where do we build that within communities? And Luis really sharing then with us about how we have impact in the workforce, right? To make it living in the workforce itself, and a living, breathing, impact, and how we then, undergird that with policy and ideas. And so I think that whole, reason for building this document, doing this work, is to have, a living conversation about how to make health literacy have the impact it possibly can. And so if there are any questions, please pop them in the chat. Happy to put them forward and ask them to the panelists. And to get you all inspired, I have a question for the panelists. So everybody, you guys are experts in so many areas in doing this work, and really shared so many important pieces of the work, but I know you're doing lots. How will you use the position statement in the next, say, 6 months? Are, where are places where you feel you're going to use it in your work? And Christine, I see you right below me. To go first, and Jill, I see you're next.
Yeah, thank you very much. I see that these types of policy briefs are really, really helpful when we have the dialogues with decision makers, whether it's local, regional, or international levels. Many of them do not have the time to read our research papers in full, and having this policy brief from International Union of Health Promotion and Education can help us at least pave the way and give them the decision points so that they can advance health literacy in policies.
Wonderful, thank you. Jill?
Well, I won't hog the floor, because somebody's put a really nice question in the chat. So if we run out of questions, I'll ask mine. But Lies Serku, and many apologies if that's not pronounced correctly, raises a really interesting question about how come so few countries have a health literacy curriculum, which is an absolutely fantastic question, and I'd love to know the answer if anyone has it.
Morgan?
I'm happy to. Okay, go ahead.
Oh,
No, but Diane was raising her hand first. Please, Diane, go first.
yes, Diane.
Hi. Yeah, I think my take on it is that I've been working for many, many years in the healthcare system, but I also work in the other systems as well in cooperation. And so often, I think it's changing a little bit, but not enough. Is that we are we see that in many of the school systems, still the issue of health, there's a sense that it's beyond their capacity and beyond their expertise, and it's kind of belongs to the health system, the medical system. It's still kind of the medicalization of health in many ways, and in many ways that's good because it means that there's issues of responsibility. But on the other hand, we're not enough bringing the whole discussion, the discourse on health, empowerment, health behavior, and health literacy into discussion. But I think Orkin is our expert on it. So I will offer over to you. The reason I had raised my hand also was because of Tatine's previous question, was that also one of the reasons we're happy to have this position statement position in health promotion, is that it brings the issue of health literacy into the discussion of health promotion, when it often is more in clinical care or in public health per se, but not enough in health promotion. So this is also helping us talk with the health promotion community about health literacy. But again, back to Orkin on that question, that great question we got in the chat. Thank you.
Thank you so much, Diane. And also thanks, Lise, for this great questions. I think health literacy is one very important topic, but it is also a topic that exists in the realm of health education and health promotion. And many school systems in the world have health education and health promotion curriculum, right? And from their point of view, they are addressing health literacy in these curricula. Of course, when we as scientists, health literacy experts whatsoever, with knowledge about certain definitions, look at what they're doing in that curriculum, then we come to the conclusion, okay, that probably is not exactly what health literacy is about. It's broader. So that might be a reason. Schools have this kind of curriculum, and for them it's sufficient. On the other hand, health literacy is a very, 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 very new topic. And I'm not sure if there will be many countries with their education systems going to develop individual health literacy curricula, since they have this kind of health education curriculum. You know what I mean? And I think we have a long way to go. It's a new topic. We need this evidence out there. We need to inform the education system, because most of the research that is being done currently is funded by health ministries or public health ministries or medical associations, and we need to get the education ministries and those responsible for schools on board in order to together with them develop a sense of understanding, a common sense that health literacy is very, very important. So these are only two aspects, I believe, that might be relevant when it comes to a health literacy curriculum, but they might be really important in trying to understand the challenges we face.
Thank you. And actually, so since you just spoke, I know Jill has her hand up, but I just want to follow up from your from the report you did last year and noticing all the digital health literacy and those components. I don't think we traditionally think that as a health education, but of course is becoming increasingly more valuable. Is there any hope? I mean, and you also have impact in Germany in the systems themselves and relationships. Is there hope that's a curriculum that might be built from the report that was around that space, to exactly your point? Like, what is health education versus what are all the skill sets we need to be healthy in this ecosystem in this world we're in today?
Do you ask me, Tatine?
I think so, but I know others have questions, but yes.
But very briefly,
thoughts,
I even don't believe that we need that, because what we have in Germany is a digital and media literacy curriculum. And as I said, these are so related concepts to health literacy, and we just need to develop media and digital literacy materials based on health content. And by implementing that, we would promote health literacy, because I think we will all get, at least in Germany, we would get exhausted trying to school make addressing health literacy because they are so overwhelmed by what's going on. They are lacking resources. I have not shown all the study results that we have. Their personal, financial, social, infrastructural shortcomings. They have other problems, and we would end up fighting with schools advocating for health literacy. Therefore, let's use what they have and try to make the best out of it.
Great points. Great. And some real nice responses in the comments as well. So Jill, you had your hand up very patiently for quite some time.
Thank you. So I totally agree that that getting health literacy embedded into school curricula is absolutely ideal if it's achievable, but often one has to wait for the political moment. And I suspect my colleagues on the call from the UK will agree that probably now is not the ideal moment in the UK, but I do think it's something we need to keep chipping away at. But there are other opportunities when health issues arise that involve children. So, for instance, sadly, there's a lot around at the moment about suicides and children and adolescents' adverse effect on mental health from accessing material online. There's issues with the rates of vaccinations dropping in communicable diseases such as meningococcal vaccinations, etc. So one of the other things we can do when health issues arise that affect children who are in school, we can say, actually, there's another way that this can be approached, and we can advocate for a health literacy approach that way. And if we do that and it's successful in one area, then hopefully that will then open the door to a more holistic approach.
Wonderful, thank you. Susie and Diane, you had your hands up earlier. Did you want to comment on that?
Yeah,
go ahead, Susie, you first.
Okay, sorry. Well, really, just to echo what everybody else has said, and certainly I can only speak from a UK context, but the pressure on schools and the burden on schools and the expectations on schools is something that is a real challenge for schools, and therefore a real challenge for us in getting health literacy embedded within a curriculum. But I also think that we're not very good at making the case as to the educational benefits that come from health literacy, so that there is a clearer kind of portrayal about what's in it for education as well as what's in it for health. So we continue to talk in quite siloed ways without kind of joining the dots for people. And I think that is something that we could probably do better at. My particular research interest is around critical health literacy, which does require a kind of a development process that looks at the determinants of health and leads to kind of social and political action, and to kind of generate that in children and young people within a formal school setting is a big ask, and presents some very real challenges. So I think it comes back to what we were talking about earlier about the need to think about targeting early, but not to be dependent on schools as the route through which we do that, and think about those other settings, those informal settings through which we might access children, families and the wider communities to undertake this work as well, alongside schools, so not just depending on schools.
Yeah, you said it so nicely before, and Arkin echoed it. What was the meta settings, or like the systems?
Super settings, yeah.
Super settings, yes, exactly. That we want to build this health informing health, these settings that make that impact, and then amplify it, right? So it's a collective rather than this organization is straining all its resources to make this possible. So, and with policies impact, there's actually a very robust conversation going on in the chat also. So, but Diane, I'll turn it over to you.
Yeah, and I will pick up a couple points in the chat as well. Yeah, I think something also I'm very much aware of is that when we talk about health literacy, I think we can get really kind of bogged down into health education and say, okay, we've done our job. And I think we have to be careful, people who are advocating for health literacy, because as we know, health literacy are skills, and we're not just skills as far as health behavior, because that is health education, health promotion, but to able to drive that, people need skills to be able to understand and feel the self-confidence and have the skills to access information and resources, use them, appraise them, etc. Critical health literacy as well. And I don't see that's happening enough. More and more, there is health education perhaps, but it's more educating about what to do for your health and why, but not necessarily giving those skills to be able to advocate and to be able to be independent about where we go for resources from kindergarten up to 12th grade. So I think we have to make, as health literacy advocates, researchers, clinicians, or whatever, let's help keep the education focus also on the health literacy aspect in health education. That's one point I just wanted to make. And secondly, at least in my country, in the country I'm in Israel, I know often schools will teach what they know that the community wants. And okay, yes, you have a curriculum and you have what's set maybe, but maybe it's only in Israel, but also there is an amount of flexibility that can be assumed by the principal and by the teachers. If you know that the community wants, the parents are expecting to talk about health or any other topic, they will have a program on it. So this is going beyond schools. When there's when it's part of the culture of the community, when it's expected, when parents and community leaders need to work together. It was just mentioned by Susie, the schools are one part of it, but then there's other aspects and the schools will want to be a part of it. They don't want to be, when there's the discussion on obesity and health literacy for promoting people's skills to get access to resources for that, and everybody's talking about it, schools will want to be part of it. I'm just giving one example, smoking and everything else. So that's one thing. And also picking up the points here about the nursing curriculum. I used to teach in a nursing school, and I'm not a nurse, but I also noticed that, again, we were teaching, health behavior models, which is important, and less on health literacy. So if that's what you're teaching, Cheryl, I'm very happy to hear it, because it's not easy for our health professionals to say we want to partner with our patients to be able to help them access resources, understand where you can get them information, etc. Come to us and use us as a resource, and not just have the health communication about health behavior and self-care and all. So I'm very happy to hear that you're teaching it. It's great. Thanks.
Thank you. Yeah, thank you. And there is a robust discussion in the chat that Diane alluded to, some many points as well. I won't summarize them all, but just thinking about how we build collectiveness across curriculums and engagement is really important. And Christine makes a really important point too of how it links to policy and how we engage in those spaces. So Christine, I know Luis is waiting very patiently, but do you want to say anything quickly about the policy aspect that you mentioned there? Because I think that is linked to our conversation here. I can highlight it if you want. This just that research is happening in this area, and that the bridge though to policy development is weaker, and we really need to think about how to better conduct the advocacy needed to undergird these super settings and to make them stronger and have funds attached to them. So Luis, you want to go next?
Yes, thank you, Titin. I feel that although we need the position paper because it helps to establish some landmarks where we want to go, we should always remember that when we are facing something new, there is naturally social resistance. So this resistance is there. It's a natural behavior. And therefore, hearing about something new that is called health literacy may put people on their guards, may put stakeholders on their guards, systems on their guards, because what is it? Haven't we have already health education or health promotion there? And why should we have another topic coming in when we don't have been able to deal properly with the other aspects of health education or health promotion? And therefore, I think that the position paper can help to increase awareness and also decrease resistance at the different levels where health literacy should be addressed. So this is one point. The second point is that, yes, look at the history of schools, societies, wherever we want to go and have a look. What has been achieved with the health promoting schools movement? How many schools really have developed curriculum in health promotion? And then the question arises, where are we going to be in maybe 5 years, 10 years from now, when we look back and we say, how many schools have developed a curriculum on health literacy, and what has been achieved with that? Just giving an example on some of the issues that have been addressed in the past. We have failed in many aspects to increase the well-being of our students that become young adults and then that go into older adults. A lot of things have not been achieved at the school level, at the workplace level, and we can see the consequences of this through the life course. So bringing the discussion of health literacy into the forum and clarifying what is this about may help make the right perspective on how to develop those capacities in order to fulfill the goal of citizens that have in their everyday life. They feel good and they develop their lives in comfort of what they wish to have. So the position paper for me is a way to decrease the resistance that is already there when we are talking about new things. And it can clarify how to make this even more acceptable by societies.
Thank you. Yeah, and thank you for those examples and the conversation about how this will be important going forward as to make impact from this statement. Jill?
I wanted to bring up the question I thought of earlier, which does take us off on a slightly different track. I'd just be interested to hear people's thoughts because, and this is also linked with the climate emergency. So I'm a family physician in an area where people are struggling with a lot of socioeconomic deprivation issues. So we're opening warm spaces and in places that are very, very hot. I know that there are cold spaces where people can go where there's air conditioning. And a lot of the people who are going to use that are going to be people who are facing the most socioeconomic challenges and are going to have the most challenges relating to health literacy. So one of the things we're talking with our local government authority about is actually whether we can actually not only have those as warm spaces in our setting in the UK in the winter, but actually use it as a vehicle for building people's health literacy skills. And because it's embedded within the communities, it fits very nicely with the sorts of things that Susie was saying. And I'd just be interested to hear from colleagues who are working in areas where there are either the cold environmental challenges or the challenges of dealing with extreme heat waves, whether they think that's a potential vehicle in their settings.
Yeah, any thoughts about those particular homes for meeting people where they are to then have the conversations around health literacy or any other non-traditional settings that might be valuable for this work? Christine?
Maybe I can respond. So in Europe, we have had a collaboration also with the European Federation of Shelters for Homeless People. And we had a speaker who was supposed to join our first conference on health literacy taking place in Dublin some years ago, but unfortunately he got ill. But his messages were very clear that we need to meet people where they are. So this is one example. We can also go to prisons, to supermarkets where people are shopping and so forth. We know that from, for example, cancer screening, that we go out there and meet people where they are instead of having them to go to the GPs or go to experts. And I think this is the future, because we see consumers are on the internet, they know where to find each other, and they know how to discuss. This is where Susie also highlights critical thinking and critical health literacy. Those that are informed, they know also where to seek advice, and don't jump on the first things that comes. So we need to take advantage of this and also be present in those fora.
Yeah, those were a lot of great examples. Susie?
Yeah, just to add to what Christine says there, that it is definitely about going to where people are at, but it's also about talking about the things that are important to them. And we know that health literacy links to so many different health issues, whether it's mental health literacy across the health spectrum, but also out into the social realm as well. And I think we need to use that as our hook, so that we're talking where people are at about the things that are relevant and important in their lives.
Diane?
Yeah, I'll pick up on that point as well. Thanks for the punt. Yeah, I think when we look at the settings, and we know in the Ottawa Charter for Health Promotion, it's where people live, love, work, love, or play. Let's also make sure that we're reminding ourselves that the whole digital world and the media world is really a setting. And it has been for a while, but it's even more so now, where people spend, and including children, so much of their time. And actually, when we're looking at what Susie mentioned about critical health literacy, we're beginning to look at critical digital health literacy as well as a setting. And I'd just like to flag a book that came out a couple of years ago, maybe it's just about a year and a half ago, on healthy settings. And we have a chapter there on digital settings and digital health settings, and we really focus on health literacy. So if you Google, I think you'll be able to find it, healthy settings from 2022, and there you'll find a chapter just on what we're talking about now. So just to flag that for you.
Wonderful. And I would say then it also thinking about the settings and meeting people where we are. We've been having a lot of conversations here in Hawaii, where the weather is very lovely, but can certainly get hot, about, within exercise and within exercise programs and, people walking or other interventions around well-being, that's a setting also for then having the, conversations around how to access the health information and what information people need. And then those are a part of the collaborative conversation and building the super settings in which people feel comfortable asking questions, comfortable building critical health literacy, and comfortable together, right, as a community, for the community empowerment aspect that I think is such a valuable piece of the additional work in the position statement now. So that's really helpful. And Orkin, I noticed you put a link to physical activity website. Did you want to say anything more about that?
Yeah, that's the website that provides the United States health education curriculum, but it's just called health education. In fact, it is Achieving Health Literacy. They're doing it since 1995. It has been updated in 2007. Then it was called Achieving Health Literacy. It's excellence, how to best address health literacy in schools. And the most recent one is even more sophisticated, more detailed, how to address the different standards in order to increase health literacy. I mean, it's misleading. I just highlighted how difficult it is when you call it health literacy, health education, which is not, and then you have it on the front page, health education. But in fact, when you open it, it really states from the very beginning, this curriculum is to promote health literacy, and it is embedded in our health education teaching. And they have like 8 different standards what a health literate child should be able to do. And you can see on the website that they are using a very modern definition of health literacy. So that's a resource I can only recommend to get into and learn more about what's been going on in the United States. But I'm not sure if this is implemented systematically, but at least it's out there and everybody can use it. But maybe the US colleagues, though.
Titi,
Thank
can
you. So
I ask another question for everybody else also, maybe for the people who are participating in our session? It's something maybe to think about for the next HARC session also, just to think about
perfect.
where do we need to go and where are still challenges we don't have the answers to. For example, why is it that we're seeing over and over that when we look at population surveys, no matter how we measure, that we see that it's health literacy is so strongly associated with physical activity, for example, and we see this over and over, and we're trying to find a logic model for that. Another question is our terminology. You know, we're looking at so much of the studies we do, whether in every way almost that you measure health literacy, we're seeing vulnerable populations or people who are struggling more, or maybe people who are, we could say, are having more, have more financial deprivation or have a lower social status that they define. We're seeing this also in an EMPL study, but what do we call it? We call it people have lower health literacy, limited health literacy. Is this terminology good enough? Are we giving labels? Are we talking about stigma? So I would think it would be really nice if we can continue the conversation and beyond this panel and maybe throughout the year, and maybe come back next year and think about as a panel and as all of you who are in this session, who are participating from different countries, different states and all, how can we better talk about health literacy without creating stigma and with being more, as I mentioned, democratizing health literacy and having less of labels, which we do as researchers, but then what happens when we want to talk to policymakers? Are we talking about people with low health literacy, limited health literacy, people who are challenged with health literacy? What does that mean? And what does that mean as far as policy, practice, and research? So just a question, maybe a challenge for all of us to start thinking about different terminology in health literacy. Just an idea.
Yeah, and maybe people who might be interested in working that up with us, then put your name and email address into the chat, and we can, you know, bring you into that discussion. But it would be lovely if this were the start of a communication and discussion going forward, and it would be lovely to meet again next year, and it would be even more lovely if I could come to Washington to do it. But there we go. So I think we're pretty much up to our time. So I'll just wrap up if that's all right with everybody. And I'm just checking with our colleagues at HARC that the chat is going to be saved as well as the presentation, the recording. Is that right?
I would hope so. I don't know. I think Jessie, our trustee IT support, would have to tell us that, but let's hope so.
Okay.
Yeah. Thank you.
Lovely.
Yeah.
Okay. Anyway, Lias, I've got your details recorded, so we can stay in touch. Good. So so we're coming up to what I would call the top of the hour. I think it's only the British who say that. So thank you so much, and I think it's been, I've really enjoyed it. I'm really sorry my camera's not working, so so you'll have to remember what I look like from the presentation slide, but I know what you all look like, so that's brilliant. So so thank you so much. Do stay in touch with our various through our various organizations and networks, and we'll see you again this time next year. Okay, everybody.
Thank you.
Bye
And I'm
then.
also, thank you, Jill. Thank you so much. And thank all the panelists. And again, because we're focusing on the position statement, and it's just today is the first day that it's been disseminated and been posted. So I put the post in the beginning of the session, now at the end. So please go ahead, read it, criticize it, critically use it, respond to it, and it is a living document, and we want to keep it going, and we want to keep it as a helpful resource. Thanks to all the panelists. It's so wonderful working with you. And thanks to HARC for inviting us to present this panel.
Thank you for letting us be there. Okay, everybody. Bye-bye then.
Stay well.